Very good afternoon to all the students. Today we will discuss one of the very much important topic in today's current medical profession, that is doctor-patient relationship. As you are a witness of many of the incidents about violence against doctors in nowadays. A recent survey by Indian Medical Association reports that around 80% of doctors in India are stressed out in their profession. Majority are witnessed as well as experienced about the violence, while the others who are not experienced are feeling stressed about the violence. So just relax and think that how this relationship between doctor and patient is different from other social relationships, like the relationship between the student and teacher, between a passenger and a bus driver or taxi driver, between a customer and a shop owner, right? So there are many kinds of social relationships, and this social relationship have in variations of bonding as well as variations of trustworthiness. But among this, the social relationship between doctor and patient is having very much high bonding, because if you think that the patient who is, just imagine that the patient who is first time consulting the doctor, and within a few seconds he or she tells the doctor very intimate, very confidential, her personal detail about her health. Okay, so our this patient are sharing by just meeting within a few seconds of doctor. So apart from it, within a few seconds or minutes, if doctor asks the patient to remove their clothes for physical examination, then most of the time the patients are giving their consent. Okay, so this is the only social relationship in which the patient are having full trust on the doctor, full trust on the healthcare provider, right? So this social relationship having several advantages. Among them, one of the advantages is accurate diagnosis. Like if the patient is feel that the doctor is trustworthy, okay, and the patient feels that he can share his personal detail, his confidential information to the patient, to the doctor, then the doctor can treat very well, and the illness or the abnormal condition of the patient can be cured. So if the patient feel ease, and if it is encouraged or counseled very well by the doctor, then they are freely disclose all the personal information, all the pain, all the symptoms with the doctor, and it helps the doctor to reach at the accurate diagnosis. Okay? Apart from that, the communication, effective communication is also having very much important role in curing the patient. The advices, the reassurance, and the nice words of the support that has been provided by the doctor to the patient is having very crucial role in recovery, apart from the medications, right? So if the doctor assures that you are okay, you will be all right within XYZ days, okay, and you have no any complications, you will be okay within how many days, then it will surely have a positive effect of the patient. This effect is called placebo effect, okay, where we are not giving any medications to the patient, but we are giving some kind of the mental support to the patient, right? So you have been witnessed about this support in the COVID-19 pandemic, right? So if uh, you have experienced that most of the patients that were died, their mental conditions are very much compromised in later days, right? And they feel that they will not be cured, they will not be survived, and that's why majority of the death of the patients are in those patients whose mental stability has been lost, and they feel that they will not survive. So surely this placebo effect will help the patient to cure. There are several disadvantages of the current practice. You may be aware that whatever the thing that we discussed about the doctor-patient relationship is changed nowadays. Okay, there you can imagine that the doctor who is having uh, full of OPD, full of the patient in OPD. So this current practice restricts to gain the trust of the patient, so the patient cannot share their personal information, the accurate symptoms and signs as per their order. It also reinforces the patient's sick role as well as hierarchical relationship between the doctor and patient, and assume that doctor knows everything. Okay, they are not listening to the patient at all, apart from the symptoms of the patient. So the doctor feel that they know everything about the patient rather than patient knowing their condition, right? So these are the disadvantages of the current practice, which reduces the relationship between doctor and patient. Apart from these advantages, there are certain barriers which also affect the in-depth bonding of the doctor-patient relationship, like the barriers from the doctor side are lack of specific knowledge about the particular disease that patient is describing or patient is suffering, right? Then lack of having counseling skills. Okay, so while any of the student is taking admission into the medical profession, these counseling skills are not uh, being taught to the student till now, right? So it has been assumed that after clearing the MBBS, the medical student or Indian medical graduates will having this counseling skill, it is assumed. But now in the competency-based medical education, this important and hidden part of the communication skill has been added as an ADCOM module. Okay, then the other barriers like the lack of time, as we discussed, the doctor having full of patients in his OPD. Okay, uh, they didn't spare enough time to the patient, enough time to listening the patient, right? Then lack of appropriate resources, like human resources in the clinic, like diagnostic resources, etc. If we talk about the barriers from the patient side, then certain important barrier like education level of the patient. If patient is less educated, illiterate, it is seen that they have a full trust on the doctor. But as the level of education increased, we have seen that this kind of patient are having less trust on the doctor. They are consulting or taking a reference of other doctors too, and then they are reaching one conclusion. Then sets like discrepancy between the male and female in the doctor patient. Okay, if the patient is female, the doctor is male, then there is a gender barrier are there while disclosing or sharing some of the personal details or personal complaints. Certain social barriers, then language barriers and ethnic barriers are also having vital role. So the take home message for today's session is that the good communication is the key pillar for proper doctor patient relationship, and it helps to avoid problems of misunderstanding between the doctors and patients, right? A healthy doctor patient relationship is not only help the doctor to accurately diagnose the illness of the patient, but also helping the patient by getting placebo effect to be cured fast. And apart from this, it will also help the doctor and fresh Indian medical graduates to success in a professional career. Thank you very much.